A health alert for parents. The CDC is investigating more than 100 cases of severe and unexplained hepatitis cases in children.
So far, 5 children have died. This strain of hepatitis has been seen in 25 states across the U.S., including Florida and Georgia. News4JAX reporter Bree Isom spoke to a local pediatrician about this.
Yes, and he says that this strain is neither hepatitis A nor B nor C. This is a whole new strain of hepatitis. The CDC announced Friday that it's investigating after 109 unknown cases of hepatitis were reported in 25 states here in the U.S. Puerto Rico has reported cases as well. 14% of children infected by the strain needed liver transplants, and more than 90% needed to be hospitalized. Most of the children were healthy when they developed symptoms that included fatigue, loss of appetite, vomiting, diarrhea, belly pain, dark urine, light-colored stools, and yellowing of their skin and eyes.
What we're seeing worldwide and in the United States, a relatively few children, but we are still seeing children, is this hepatitis that's neither A, B, or C. We do immunize children against hepatitis A and B.
Dr. Jeff Goldhagen, the chief of the Division of Community and Societal Pediatrics at the University of Florida, talked to me about the possible cause of this strain of hepatitis.
This hepatitis seems to be associated with a routine common virus called adenovirus, which is a routine virus that causes upper respiratory tract infections.
Health experts say adenoviruses are commonly passed around daycares and schools. They typically cause nothing worse than something that feels like a stomach flu for a few days. It's not clear what's driving these cases in young children.
Well, at this point in time, it would be far too early to suggest that this is related to COVID or a symptom of long-haul COVID. So at this point in time, that would be an inappropriate statement to make. But it is an appropriate statement to make that has nothing to do with the COVID vaccine.
Doctors say, though it's alarming, this strain of hepatitis is rare. Now, as for right now, doctors say there really isn't anything to do to prevent your child from contracting this disease. And coming up on News4JAX at 11, the advice this doctor has for parents as this disease spreads. Mary, back to you.